Hello. In this video, I'll answer the 10 most frequently asked questions about Microgynon, a commonly used combined oral contraceptive pill. This information is based on official patient information leaflets and reliable medical sources. What is Microgynon? Let's start with the basics. Microgynon is a combined oral contraceptive pill that contains two hormones, levonorgestrel, a progestogen, and ethinylestradiol, an estrogen. When taken correctly, it is used to prevent pregnancy. How does Microgynon work? Microgynon prevents pregnancy in three main ways. First, it stops ovulation, meaning the ovaries do not release an egg. Second, it thickens cervical mucus, making it harder for sperm to reach an egg. And third, it thins the lining of the uterus, reducing the chance of implantation. How should Microgynon be taken correctly? Take 1 tablet every day at roughly the same time. A standard pack contains 21 pills, followed by a 7-day pill-free break. Taking it consistently is essential for maximum protection. How effective is Microgynon? When used perfectly, Microgynon is more than 99% effective. However, missed or late pills can reduce its effectiveness in real-life use. What if you miss a pill? If you are less than 12 hours late, take the pill as soon as you remember. If more than 12 hours have passed, contraceptive protection may be reduced. Always check the patient leaflet, as advice depends on the week of your cycle. What are the most common side effects? Most side effects are mild and temporary. These may include nausea, headaches, breast tenderness, mood changes, or spotting. They usually improve after the first few months. Who should not use Microgynon? Microgynon is not suitable for everyone. It should not be used by women with a history of blood clots, certain heart or liver conditions, hormone-sensitive cancers, or during pregnancy. Always consult a healthcare professional before starting. Are there serious risks? Serious side effects are rare but may include blood clots, stroke, or heart attack, especially in smokers over 35 or people with risk factors. Seek urgent medical help if you experience leg swelling, chest pain, or sudden shortness of breath. Does it cause weight gain or mood changes? Some users notice mild weight or mood changes, but significant weight gain is uncommon. Most people tolerate Microgynon well, though effects can vary individually. Does Microgynon affect future fertility? Fertility usually returns quickly after stopping the pill, often within a few cycles. There is no long-term negative effect on fertility in healthy women. I hope this video helped you understand Microgynon and how to use it safely. If you found it useful, don't forget to like the video, subscribe to the channel, and turn on notifications for more women's health content.